Hello, I'm Barry Kesselman, your host of Carousel today. Welcome aboard. As you know, I like to hop on a horse and ride around looking for interesting people who have interesting things to tell us, interesting subjects, and a nice way of presenting it. And we're fortunate to have the same kind of guest here today. Before I introduce him, however, I want to say this is going to be my last show as host for the season. I have the fortune of becoming what is known in Florida as a snowbird, and I will be moving to the south for a little while. So I want to say goodbye to all of you who have watched and enjoyed the wonderful guests that I have had in the past. Today we're going to continue kind of on a theme that we started last time, which is medicine, some of the problems with medicine, some of the challenges for doctors and the stresses and strains they have, and some of the new things that are going on in medicine that are a bit different from what a lot of you may be aware of. My guest today is Dr. Elliot Goodman, who comes from England, which you will find out as soon as he starts to talk. He has his degrees, undergraduate and medical degrees from Cambridge. He also was in surgery doing surgery as opposed to being under surgery at Maimonides Hospital and Beth Israel Hospital. And he's done so many things I need to check with my notes here. He was chief of bariatric surgery at Montefiore, which is weight loss surgery, and we'll get into that for a bit of our conversation. And co-director of the the University Institute for Surgery of Morbid Obesity. He also was involved with Columbia University and a lot of other things that if I went through all of them, we would take most of the show. So without doing that, let me introduce with great pleasure Dr. Elliot Goodman.
Good evening.
Hello, good evening, welcome.
Thank you very much.
I really appreciate the fact that you came in from Manhattan, drove, which shows that you have an entrepreneurial spirit, and you're quite successful in getting here. So welcome aboard.
Thank you very much.
I do want to talk about your entrepreneurial activities, but before that, I would like to get into the activities that you've been involved in most recently with patients who have, I suppose the word, taking it from the resume, is morbid obesity. So, and that is such a problem in this country today, as you know better than I. Could we spend a little bit of time talking about that and some of the things that you've done and are going on?
Sure, of course.
Please.
So what morbid obesity is severe obesity. Obesity to the point that the whole physical, mental condition of an individual is impacted. And as a rough measure, any patient who is about 100 pounds or more above ideal body weight is considered to be morbidly obese. And when an individual gets to that level of obesity, then they develop other medical problems such as high blood pressure, diabetes, heart problems, lung problems. And obviously this impacts not only on their quality of life, but their life expectancy. And unfortunately, for most of the time, medical treatments, whether it's diets or medications, exercise, in the long term are not successful. So these patients ultimately may require a surgical remedy.
Now, I've read some patient reviews of yours, and they were glowing from both your patients and family members of your patients. So whatever you do with these people, you're admired and respected for it. And I don't know if you handle these areas in a particular way, different from others, or the same general way as other surgeons that operate on obese people.
I think you have to be sensitive. I think you have to be non-judgmental, and you have to listen to people. And there's always sort of a subtext to a patient's history. We once did a study of the psychological makeup and background of these patients who undergo bariatric or weight loss surgery, and anything up to 20 to 25% of our patients had a significant psychiatric history. They were chronically depressed. They were often physically or even sexually abused as children. So it's one surgical specialty where it's not just a matter of cutting open a patient and performing an operation, but it's more holistic. You have to really reach out to the to the whole patient and deal with physical, mental, emotional issues.
Now, I know there's several methods. There's surgery, liposuction, I guess, is a consequence of it. There's also lap bands. There's also stomach squeezing, sewing, cutting. I'm not sure what it's called. Do you work in any particular area or like one compared to another?
Well, there are three, I would say three basic procedures nowadays. Almost always nowadays it's performed laparoscopically, meaning through several small incisions, about a half an inch, quarter of an inch wide. The lap band involves the placement of a plastic inflatable band or ring around the top of the stomach to slow down the passage of food so that patients have to eat more slowly and have to eat smaller portions. There is something called the gastric bypass, which is more invasive, and it actually involves cutting and stapling across the top of the stomach, so that the stomach, which typically is, let's say, the size of a football, becomes the size of an egg. And then additionally, we cut the intestine and connect part of the intestine, the small intestine, to that little egg-sized pouch of stomach. And the purpose of that is to bypass the first few feet of the intestine. And in doing so, we limit the body's capacity to digest and absorb food, and so therefore fewer calories are absorbed. But one consequence of that is that vitamins may not be absorbed but before iron, calcium, so those patients have to be watched carefully to make sure that over time they don't develop nutritional problems. There's a more recent operation, which is somewhere in between the band and the bypass, called a sleeve or sleeve gastrectomy. Mm-hmm. That involves removing about 60% of the stomach, so that now the stomach is a long tube, about 6 ounces in volume, as against 20 or 30 ounces. Wow. And the purpose of that, again, is to limit how much food a patient can eat at any one time. And these are the main operations that we perform today in the United States. But all of them have their risks and benefits, and all have their pros and cons.
Were you doing any work in the relationship between obesity and diabetes?
Yes, so if you look at type 2 diabetes, that's adult onset diabetes, which is becoming more and more common worldwide. About 80% of patients with type 2 or adult onset diabetes are overweight. And it became apparent after you perform these operations that an overweight diabetic very quickly no longer requires medication for their diabetes, or the number of units, the amount of insulin that they require to control their blood sugar drastically dropped. And it wasn't because they had lost weight, because this would happen even before they had lost any amount of weight, within a matter of a couple of days after surgery. And when researchers looked into this, it appeared that there was a link between the stomach, the intestine, the pancreas, which makes insulin, yes, the rest of the body, the brain, all controlling insulin production and the reaction of the body to insulin in terms of controlling blood sugar. And by manipulating how we process food, by cutting, stapling, rearranging the bowel, this affects the relationship between the gut, the pancreas, and the brain to improve insulin production and the sensitivity of the body to insulin. And so there's now a lot of work to see whether we can do similar sorts of manipulation of the body as in a gastric bypass, but with less invasive techniques. Very
interesting. Is there really a second brain in your abdomen? There's been a lot of popular press about there's a second brain in our bodies that controls our whole digestive system.
Well, there are, I would say, nerve circuits which run between the intestine, between the pancreas, and between the brain. And there are hormones which act as chemicals, yes, to control all of these pathways. Good. And by manipulating how food passes through the intestines, you can manipulate all of these chemical signals.
Fantastic. So surgery. is difficult, highly rewarding, I suppose, in the monetary sense for the most part. But it's got to be hard on surgeons who are called upon to do many things and spend many of their life hours involved in that. Could you speak a little bit to that?
Yeah, there was a study about 3 or 4 years ago, and it was an anonymous survey of about 24,000 surgeons, members of the American College of Surgeons, and about a third of them, so about 8,000 or so, replied to the survey. And it was really looking at what were the stresses of being a surgeon, how many hours a week surgeons were working, looking at the incidence of mental health issues in these surgeons, looking at the effect of being a surgeon on family life. And one interesting question is whether surgeons would recommend and encourage their children to
would surgeons recommend and encourage their children into the field?
Well,
since you know, a question.
50% of the respondents said they would not encourage their kids to go to medical school and become surgeons.
So what did the study find in relation to the effect on the surgeons themselves?
Some interesting results. On average, the age of the surgeons who responded in their late 40s, so pretty much my age, and they'd been in practice for about 17 or 18 years, just as I have. And there was a burnout rate of about 40%, so almost half of the surgeons answering the survey said that they were getting burnt out because it was just too stressful. On average, they worked 60 hours a week. So if you figure if it's 5 or 6 days a week, then they were working 10 or 12 hours a day. There was an instance of 30% of depression in these surgeons. And about 35% said that being a surgeon had a pretty negative effect on family life in terms of relationships with spouses, with children, etc. So, I think the message was it's rewarding work being a surgeon, but there's a price to pay in terms of the rest of your life, your personal life. Fascinating.
What do surgeons have an opportunity to limit their practice or the hours of the day that they work, or not accept patients?
There are lots of choices to be made, and there are incentives to work hard, because obviously the more patients you see, the more operations as a surgeon you do. In our system of healthcare, which is what we would call a fee-for-service system, whereby in general a doctor gets paid for seeing a patient, for performing an operation. The more patients you see in the office, the more operations you do in the hospital, the more money you can generate. So obviously there are incentives to work harder, see more patients, generate more income, and obviously if you have financial obligations, you're married, you have children, etc., putting children through college, then you have to somehow meet your financial needs. It's tough. I mean, you've got to pace yourself. If you are on call too much, if you're spending too much time in the office, in the operating room. On the one hand, there are certain positive effects, but then you lose something on the other end.
Sure. Our previous guest, Dr. Jim Slater, talked about the stress and the overwork and time in relation to his patients, and he was a primary care physician, where he felt he wasn't practicing the medicine he wanted to practice, and stepped out into concierge medicine, where he didn't worry about insurance and insurance claims and fee-for-service. He just practiced medicine with the people that had signed up with him, and that was his way of doing good medicine and getting out of the squirrel cage. And it sounds like surgeons are in the squirrel cage too. Probably don't have the option of concierge service because they don't have primary contact with patients. What about you? Are you looking to branch off into other areas beside your weight loss surgery?
Well, I think if you actually look at most physicians or most surgeons, they still get a kick out of being physicians. As surgeons, what we like to do most is to operate And I think that the essence of being a surgeon, being in the operating room, finding a problem, using your hands to perform an operation and fix the problem, and then seeing the patient, recover and, become obviously better as a result of something that you actually have done. That essence of surgery, I think, still appeals to me, appeals to my colleagues. But unfortunately, there's a whole bureaucratic layer upon layer upon layer on top of that essence of being a surgeon. And it's that, I think, that over time gets at us and takes the edge off of our enjoyment. And it's the bureaucracy of dealing with insurance companies. It's the bureaucracy of dealing with hospital administrators. It's the bureaucracy of practicing defensive medicine, in order not to be susceptible to a lawsuit. So over time, I think, when you look at that 40% burnout, I think a lot of that bureaucracy of the periphery of being a surgeon is what's responsible for the burnout. So therefore, surgeons such as myself, look for other ways of keeping engaged, keeping intellectually and emotionally, spiritually engaged in the practice of surgery. And there are other ways which are less directly involved in patient care, which can keep you interested in the job.
And you have chosen one that's a bit different. That's why under your title we have entrepreneur besides surgeon. And so I'd like to talk a bit about your entrepreneurial spirit and how it relates to medicine and some of the things that you're doing and accomplishing and how one goes about doing that. So can we step into that?
Sure. A few years ago, I started to talk to inventors, entrepreneurs, businessmen starting up small companies aimed at bringing new technology into medicine. And I found that there are a lot of people, often salesmen who had, interesting ideas, or engineers who were able to look at a problem for which we didn't have a good solution. And using creativity, using lateral thinking, they could come up with an interesting idea to fulfill an unmet need of how we fix a problem, how we perform an operation more quickly, less blood loss, fewer side effects. And I started to advise and consult with these companies to provide advice and feedback as a surgeon. Mm-hmm. And after that, there would be investment bankers or venture capitalists who would be interested in making investments in these new companies, putting in a certain amount of money so that they could do more research and development. They could begin to sell their devices in the United States or elsewhere. And they would then ask me, well, what do you think of this new device? Does it fulfill an unmet need? Is it better than the competition? Is it going to make a difference to how you treat patients? Is it something which is going to be profitable to the company? Should we invest in it? And in the same way as I can't paint a picture, but I perhaps know what I like in terms of art, I thought, here is something a little bit different from being a clinician, being a surgeon. Mm-hmm. But, I had certain skills in terms of analyzing somebody else's bright idea and saying, this will work because of A, B, and C, but, perhaps they need to do something slightly different, look at it a different approach, use it in a slightly different manner, etc. And after a while, more and more companies would come to me and say, well, can you advise us on this technique, this approach? Can you arrange for us to run a trial in this country or in that country? And so therefore I became a medical matchmaker. So I began to match companies in this country, in Europe, with certain banks in other countries. There have been some US companies which, because of the strict regulation of trials in this country, They can't perform a trial on a prototype device here, but they would want to go to Europe or India or Israel. I would then use my contacts to find a hospital in India, hospital in the United Kingdom, hospital in Israel, so that the US company could run a trial in another country, get some results, and then bring the device back to this country, and then hopefully get FDA approval.
That's very good. Obviously, you are highly sought after. Can you give us an example of a program that you put together that's been successful?
Sure. So I'll give you a couple of examples. There's a Canadian company which is making a new form of robots, surgical robot. Now, at the moment, there's only one big company really in the world which makes surgical robots, and they have a pretty much monopoly. However, there are several companies trying to develop other versions of the robot, smaller, more sophisticated, often cheaper. So one Canadian company was interested in running trials, again, out of the United States or Canada, and I was able to find some surgeons in India and a hospital in India who were prepared to learn the techniques and bring the robot over. And so in a few months' time, they're going to start performing gallbladder surgery with this new robot. In the opposite direction, there was a company, or there is a company in India which makes drugs all from plants. These are completely natural, plant-derived chemicals. And one of them has great promise for the treatment of Parkinson's disease, such as Michael J. Fox has.
Yeah, debilitating.
Sure. And so they had done an early trial on about 50 patients, showing some early promise. But what they wanted was a bigger trial, and a trial which would enable them to get approval to bring to the American market this new botanical. And again, I was asked to find researchers, neurologists, Parkinson's experts in this country to get engaged with the Indian company and to start running trials. And we're about to sign a contract with the Cleveland Clinic and Columbia to start running trials on this new plant-derived agent.
There you go, your old connection to Columbia coming around again. We just went to the New York Botanical Gardens 2 weeks ago where they had an exhibit on plant medicines and how so many have been derived from that. Sure. But it was really interesting. So maybe we're going to add another one the next time they had the exhibit. About how many of these types of entrepreneurial enterprises are you involved in or consulting with?
I would probably say that on average, every month, every other month, I'll start to talk to a new company. If you look at Israel, for instance, it has more startup companies per head of population than any country in the world. I mean, it is an amazing pressure cooker for new ideas in clean technology, computer software, and biotechnology, medical technology. And I'm always talking to people in Israel about some of the amazing ideas that they're coming up with. But again, because it's a small country, it's the size of New Jersey. They are limited to what they can do in terms of, for instance, running trials or generating investment. So I'm working with a couple of Israeli companies to run trials in the United Kingdom on a new infant formula and to develop a new medication to stop bleeding in the abdomen during surgery or after trauma, and we're talking to some companies here in the United States. That's amazing.
Do you get sometimes the inventor, sometimes the funding source, capital source, different people approach you, or is it always the same kind of beginning for you?
I think particularly in today's economy, there's there are far more inventors out there than there are people with an open checkbook. So typically, I'll get asked by an inventor with an idea who's looking for money to try and match them up with somebody with a checkbook, and it's a challenge to get people to foot the bill, because it's risky, and people don't want to risk anybody's money without some idea that they're going to get a return on their investment and have a successful enterprise.
We put all of these shows on YouTube, and 3 shows ago we had a fellow named Jack Cohn who has invented several instruments, gadgets, I'm not sure how to define them, in the medical field. If you check the URL for that, if you go check out our show, you might find another source or two of some good equipment for you. You are obviously highly respected, and people are coming to you. Has it affected your ability to do your regular surgery?
No, for several reasons. Number one is with the connectivity that we have nowadays. You know, with a smartphone, you can do a lot of things in between operations in the car. You know, while shaving, if you know, doing 2 things with 2 different hands. So it's not that difficult to sort of juggle around things and do things during downtime. And one thing about an operating room is that it often takes a long time in between operations to actually get the room ready. So that there's always time to do other things.
Unfortunately, we're at just about the downtime here. And I know you came here on almost an instant's notice. We actually spoke for the first time this morning, and here you are. So you have the ability to do that, and very well. I just want to say goodbye to everyone on your behalf and mine. It has been a pleasure being your host. Perhaps I'll do it again sometime. Meanwhile, enjoy the Carousel show. You'll find us on YouTube. Look for Barry Kesselman, Carousel, Cablevision, Life on the Carousel, and you'll find all of our shows there. It's been a pleasure serving you, and it's been a great pleasure of mine to have guests like Dr. Goodman here, who contribute so much to society. And hopefully your activity in particular is going to do something really good for a lot of people, be it Parkinson's or obesity or the next one that comes down the line for you. And I can't tell you how much I appreciate you filling in here. You are hardly a fill-in candidate, but you were very good. Why don't you take the opportunity to say goodbye too, since you drove here all the way from Manhattan. Just give a look and say goodbye.
Well, thanks for listening.
Thank you very much. We'll see you perhaps again next spring. Okay, thank you. She kept giving me the, after we had the cutoff.